We're going to see if we blast you out with this or what. Hi, I'm Jean Berger, and as a member of the AOD Partnership Board, it's my pleasure to welcome you to today's meeting. We're going to start with, I guess I'm officially calling this meeting to order, and I'm inviting all of you to sign up on our sign-up sheets today. We do keep track of everybody who attends, and it helps us with our in-kind financing for grants and other things. So it's really important that you register as being here today and spending time with us. And if you're a guest or here for the first time, your name probably isn't on this sheet, but there are opportunities in the back of the packet for you to add your information so that you'll be official next time, and opportunities for us to contact you in the future. Both of these sheets are identical, so you don't have to sign them both. You just need to, they'll probably end up in the middle back there. But there is one extra column this month, and it's this green one. And the green one is your opportunity to tell us if you'll be available to attend our January 30th, 4th annual celebration of the accomplishments of the AOD partnership. So again, that's the 30th of January. It's right up there on the screen. It went by fast, but it's also going to be, there'll be information listed on the stats updates. If you picked up a stats update listing, it's on the back. It'll be at the Jefferson Street Inn. We're starting at 5:30, and we invite you to join us to celebrate the accomplishments of the AOD partnership and our partners. That brings us up to some of our reports. I guess first I should ask, does everybody have an agenda, or do you need some passed around because they're up here in the front? Send a whole pile towards the back. Thank you. On the back of the agenda is the minutes of last month, or our last meeting on Tuesday, October 1st. And if there are any additions or corrections, we entertain those now. Otherwise, those will be placed on file. Hearing none. Okay. Pat's not here for our treasurer's report, but Melissa's pulling that up. Oh, great. She expects my bifocals to work with this. At our board meeting, Pat Kinney, our treasurer, reported that the balance as of October 31st for the partnership is $1,906.89. There were 2 checks that were received but are not reflected in the current balance, and those are $180.69 from Noodles & Company and $150 from the Marathon County Health Department for the recovery lunch reimbursement. So adding those together, pardon? Oh, okay, and then we have money in the Wausau Area Foundation for the AOD Partnership Fund. That balance is currently at $1,359.20. So that's our treasurer's report. Are there any questions regarding that? Otherwise, we'll move on. I'm going to introduce Lori Brandt, who's also a member of the board, who is going to conduct our annual AOD board elections.
Before we do that, can you just cover the bylaws and then have Francis do a funding update?
Sorry, it's on the agenda. I missed it. I was obviously a stand-in as of about a half an hour ago, so I appreciate the extra help from Melissa. The board did go through our organizational bylaws and update some of the details that needed to be correct so that we would be in compliance with our 501c3 status, with our status as stated in some of the grants that we do. But those bylaws are posted on the website, so we encourage you to look at those. And then I turn it over to Francis, who's back in the corner here. Francis Irwin is going to update us on opportunities to donate to the partnership.
Thank you, Jean. As you may know, the AOD Partnership is a 501c3 nonprofit charity, so it is possible for people to donate to this organization and receive a tax deduction. Those donations allow us to further expand the work of the partnership and do some of the amazing things that we have been able to do. Things like the pushback campaign, things like the collection of prescription medications so that folks don't have to keep them in their home and be at risk of being burglarized or other things because those things because the prescription drugs are there for people who would like to have them but shouldn't. So in addition to us being a 501c3, we have a fund at the North Central Community Foundation that you can donate to support our work. But more than that, at this time we are looking for folks to help us with our fundraising committee. It's important. The work that we do in this community is vital to the health and success of our friends and neighbors as well as our economy. So we would invite you to join us in support of the partnership. And so if you would like to, please let me know. I will be here for the meeting, or shoot Melissa an email. She is good at email, so she will get that right around. And we very much do thank you for all the support that you have provided to us, and we look forward to the continued partnership.
Thank you. As Jean said, my name is Lori Brandt, and I am on the AOD Partnership Board. And I've had the privilege of serving on the nominating committee with Ben Bliven and Melissa Dotter. For those of you who know this dynamic duo, they're not only hard workers, but they're a heck of a lot of fun to work with. So as the culmination of our work together, I have also had the privilege of introducing the slate of nominees for this year's partnership elections. After I introduce each individual, I would ask that you stand and just say a few words about yourself, introducing yourself to the membership gathered here. So we'll start out with Secretary Nancy Cedar. Nancy's employed by the Wausau School District, and she is being appointed to a one-year term being vacated by Jean Berger.
Hi, I'm Nancy, and I have been on the AOD board. I believe I'm starting now my third year. And I have been working for the Wausau School District for, I think, about 12 years, and I coordinate the out-of-school programs, so that can be enrichment, mentoring, tutoring, all of those kinds of things for both elementary and middle school youth. So I see the partnership as a real close fit in terms of prevention. I actually came on when Jane Freitag was leaving the district, so I represent the district. Thanks.
Thanks, Nancy. The treasurer nominee is Patrick Kinney from Marshfield Clinic, and in his absence, I will read just a little statement about him. Pat has served as AOD Partnership Treasurer since 2012, previously serving as a Sustainability Committee Chair. He's been a solid foundation for the transition of the AOD Partnership through some turbulent times, and has volunteered to see the transition from the drug-free grant through to success in a strong 501c3. The next person on our slate of officers is Vice Chair Laura Scuderi from Bridge Community Clinic, and I don't think she's here. So Laura is not new to the AOD Partnership. In 2011, she served as the Promotions Committee Chair and as an at-large member to the AOD Board. She has shown interest not only through her role as Executive Director of a federally qualified healthcare center, but also on a personal level with passion for substance abuse and mental health. The at-large members, Andy Benedetto is a recently retired long-term AOD Partnership advocate. Andy has been involved in local, regional, and state nonprofit efforts for many years and has been a huge supporter to the AOD Partnership. In late 2012, Andy helped oversee the merger of two local nonprofit counseling centers, Family Counseling Services and Peaceful Solutions. He's been enjoying retirement and his new grandbaby since winter of 2013. Maria Gulan, the Vice President of Operations and Service. I see you're right over there. Would you like to say a few words?
Good morning, everyone.
she said. I'm Maria Gulen, Vice President of Operations for Aspirus Clinics. I am a registered nurse by background. I have a master's in business, and I worked for Aspirus for about 20 years. I also sit on the Wausau Child Care Board and the Aspirus Grandview Hospital Board. I reside in Mosinee, have 3 children, twin boys that are sophomores in college, so I'm broke. But very anxious to get involved.
Terrific, thank you. Our next nominee for one of the members-at-large positions is Maureen Jorgensen. Maureen is the Senior Vice President of Sales and Service at People's State Bank.
Good afternoon, or morning. My husband and I recently moved to the Wausau area from just outside the Appleton area. I've been in banking for more than 20 years. But I'm honored to be considered for this position as personally I am in recovery. I celebrated 25 years of sobriety this past September. In my work in the Valley, I serve on the Step Industries board. Step Industries is a packaging company that employs only people in recovery. And the purpose of STEP is to be just that, the step to be mainstreamed back into regular employment. And I worked with that entity and interacted with the in-house treatment centers in the Valley for several years and was very fulfilled in that volunteer work. So I'm super excited to have this opportunity. So.
Thanks, Maureen. And finally, last but not least, Lance Leonard, an Assistant District Attorney for Maritime County.
Hello, my name is Lance Leonard. I'm at the Assistant District Attorney's Office. I've been there for the last 7 years. Feels a lot longer. But right now, I really would welcome the opportunity to be on the board. In my current position at the DA's office, handle all of the felony drug trafficking and drug possession offenses in Maritime County, so this is something I deal with on a daily basis. Particularly if you look on your stats update sheet, the heroin and other opiates aspect of the community and the problems we're having. In the last 7 years, I've seen a dramatic shift in my work, and I really welcome the opportunity to do what I can with this group, bring some knowledge, whatever that may be, to the group, and hopefully we can begin to make a real difference. Thanks.
Thank you. At this time, I'd like to accept any write-in nominations from the floor. Okay, hearing none, can I get a motion to accept the slate of candidates?
I move.
Ron, thank you. Second?
I'll second.
Francis? All in favor?
Aye.
Anyone opposed? Motion carried. Thank you.
It's your turn.
My turn. Okay, let me thank you, everyone. Probably the fastest election results you'll ever see. That's the way we do it here. Everybody in front of you has a copy of our stats updates, or you should. If you don't, we've got extra copies, I'm sure, available here. Just some things to point out that we're scrolling through the announcements that are related to the stats as well. First up on the stat list was our online support network. We're calling it Take Back Youth. So it's kind of a play on our pushback against drug abuse initiative. We're calling it Take Back Youth. It's not just going to be for parents. You don't have to be a parent to be visiting this site. It's really our goal to have a one-stop shop for anybody that's concerned about a loved one that may be dealing with addiction. If you want to get involved in the community in areas of recovery, it's just kind of our goal is to make it really easy for folks. Bettina, who's in the back, Bettina, hello. Bettina is our intern, our rock star intern. She's only got a few weeks left with us, and this makes me very sad, but this has been her charge. And we're going to be looking for people to help out with that effort, helping with auditing the site. We're looking at putting a blog feature on the site to have people have that online discussion. So if you're interested in that, please let us know. Now I'm just going by memory on there. I think the next thing on there was the heroin and opiates stat. We do have a meeting scheduled for the 16th of December. You have the time there and the location. And we've got a lot coming up, including our pushback, thank you, our pushback press conference. Our fourth and final one of this year is going to be on December 18th. We're going to be focusing not only on a reflection of all the great things that have happened over the last 7 months, are going on 7 months, but also to look to the future. We're going to have people talking about what it is in the community that can support having drug-free youth, for example, looking at things like risk protective factors. Jackie Carantini from UW Extension is going to be doing that. We're also going to be having Frances Irwin giving us, she's going to be our kind of MC for the press conference that day. She's going to help us look at how the community can support recovery. We're also going to have Representative Mandy Wright there, who's going to talk about, not only our community at our micro level, but also at a macro level, how what we're doing here is impacting the entire state. So it should be a great event. It's going to be at the Center for Civic Engagement, so otherwise known as the new building at UWMC in the Sonotag room, which is right in the front entrance there, and there'll be some signs for you. So we hope you can make it for that. We're also, as far as, I'm going to let, well, you can see the rest of the updates as far as with our paired driving group, who's going to be looking at moving forward some of the initiatives included in their work plan. We're also, as a heads up, City of Wausau is going to start discussing the sober server ordinance, which would mandate or regulate if somebody is serving alcohol, they put a limit on it at .04. So that's something that Nina has just passed, I do believe. City of Wausau is also looking at doing that, and that's going to be discussed at their December 16th Public Health and Safety meeting. So there's your heads up on that. I just got the email earlier today. And that's going to help us deal with impaired driving so our servers are not impaired themselves. Also with the Real Happy Hour, a lot of great promotion has been going on with that initiative. And they're always looking for ways. That group is not just AOD Partnership, that's the Healthy Eating Active Living, that's the Hunger Coalition, that's the Literacy Council's affiliated with it, and a variety of other different groups looking at building up our youth so then they turn away from things like drugs. That initiative is looking for ways to get the information out. So in your business, in your personal life, if you work with a PTO, for example, they're always looking for ways to kind of spread the word on the Real Happy Hour. They're also building up support in Western Marathon County for substance abuse related initiatives. Currently, there isn't an organized effort out there beyond what we're trying to provide here through the AOD partnership. So we're looking at how can we build them up to take some ownership and to kind of move things forward there. They've very excited about the Sheriff's Department's new canine, so there's been some initiatives around that. And they do have a meeting coming up on the 10th, and you can see there that it is out in Edgar. So if you're interested in working, or you do work in Marathon County, or you have contacts in Marathon County, please extend the invitation to them. And finally, as far as the stats go, Youth for Youth is very exciting. If you haven't gone past the billboard by the fire department right now, that's one of our Youth for Youth creations. They did one for our pushback against drug abuse initiative. IDEA Charter School has been very active. They're looking at a variety of different initiatives, from taking video testimonials from their classmates, looking at creating PSAs. They're very gun-ho there, and we are looking at re-engaging the EA and EGL charter schools that are out at Wausau East. And also Newman has reached out, who is another new contact and another new partner to the table with the new guidance counselor there. So we're always looking for youth initiatives. And so if you're looking at possibly being a mentor to these groups, they're so active and they're so busy, it's going to take a whole village of us to help just not steer them in the direction they're going, but make sure that they have some support that they need. So the next meeting is actually tomorrow, December 3rd at IDEA Charter School, if anybody would like to attend that. Last but not least, some of these things from these announcements. For those of you that have not attended our January celebrations, they are a lot of fun, a great time to reflect, a great time to, kind of celebrate the work and the great things that have been done here in the community related to substance abuse. We do have a meeting, or we do have a date set, we do have a time, we do have a location. We are going to have cupcakes, and we're going to be highlighting kind of the stars of our community in helping us achieve our mission to eliminate the misuse of alcohol and other drugs in our community. So it doesn't have to be people in the spotlight, it could be people behind the scenes that people may not know what's going on. So nomination forms are going to be coming out soon for that. Should be a good time, hope you can attend. We also have a media training coming up. I don't believe we sent out information yet, an update, but it will go out. We have a media training next Friday the 13th, which is kind of appropriate. When you think about media, a lot of people are kind of like, cameras run the other way. We're giving this opportunity to build everybody's capacity. So if you do have interest in this, we are charging $25 a person to help offset some of those costs associated with bringing a great trainer here. I've gone through his trainings a couple times now, and he's fabulous, and even get the chance to go online or go and do like the video cameraing and critiquing, and it's very, very good. And you actually can register online. It's on the back of your stats updates. You can see the link there if you're interested. Space is limited for it. If we get to see too many, we'll have to look at limiting it per agency. But if you do have interest, please go ahead and register for that. Finally, we have had some discussions through our heroin grant awarded to us from the Department of Justice on having trainings for people on drug identification, how to identify if somebody's using, how to approach that person, what are some of the new drug trends, any safety concerns that you may have. And what we've done is we've blocked out 2 days for this training. It is a 2-day intensive training, so it is a commitment. However, the information that is shared, if you're working, we're targeting specifically those that are working with youth serving organizations, schools, faith-based community, basic needs groups, if you're working with the Salvation Army or the Neighbor's Place or so on. If you want to get to know more about this, more details will be coming soon on this, but you do have the dates. It's going to be the same thing, so either the 13th, 14th, or the 3rd or 4th. And if we have a lot of interest, we're going to look at redoing that. So that is all the stats and announcements and all that good stuff from my end. Do you want me to ask? Is there any partner updates? No? Okay then, wonderful. Just to point out again that there are a bunch of materials on the back that are related to what we're talking about here today. We are going to be focusing on one of those growing concerns that we've looked at, we've discussed, especially when we look at things like heroin or methamphetamine use. A lot of the times it starts somewhere. We've got a great group of presenters here today with me. I'm just going to start us out with highlighting some of our results from our medication assessment. In 2011, we realized, when we started addressing this issue, we realized we had no baseline data. We had no idea how often are people misusing their medications. We had no idea what's that perception of risk. How bad do people really think that it is? What's the perception of availability? Do they just think that, doctors are just writing out prescriptions left and right, for example? What is that perception? As well as, in 2010, it was our first year that we launched our permanent Dropbox sites for our medication disposal program. We wanted to know, do people know where it is? Are they using it? So we wanted to measure 4 different things. So we did that in 2011 with St. Norbert's College. We phone called, I don't know if that's correct terminology, but we phoned 400 individuals and organizations, or individuals in the community within the Wausau metro area. We kept it to the 4 key zip codes in the Wausau metro as a representative sample of the entire county. Just because of costs, it was pretty expensive that first time around and this time as well. But we found that there were some really good results and that we were able to compare them. We were excited to be able to partner with, as you saw, UW River Falls is actually the one that did our survey for this time around, our community assessment. And I'll go over a little bit of it. I'm going to breeze through it just because you have copies in front of you. And I just got this literally yesterday at 1 p.m. So I didn't get a chance to scour through it yet either, but a summary will be coming out soon. So if anything's missed, anything's glaring, just go ahead and ask the question. So again, like I said, the research objectives, we had 4, and I already went through those. The sample size, like I said, the Wausau metro area, we covered these 4 zip codes here. Compared to last time, we actually did mailers with this, with us, River Falls. That's usually how they do surveys. They feel they get truer results because the phone calls, you never know who's going to be there at certain times of the day. And whatever how the 2 research centers do it, they both have their reasons for the way they do things. But what we did is we wanted to make sure we still had a representative sample. So they sent out over 1,500 households. To 1,500 households, they sent out a survey. It's a 3-page survey. And if people want to see copies of that survey, or if you work with a different community, that's looking at doing a similar thing. We have copies of that survey available. But we wanted to make sure we got a representative sample back. So we did have 402 return. And while I don't pretend to understand social statistics, it was my absolute least favorite class, I do know that this is a very good confidence rating. They shoot for over 95% confidence rating, that it is reflective of the community that they're trying to work with. Okay, so the profile of respondents comparatively to 2011, and that's what a lot of this is going to be, is if we've seen any change. Distribution of geography and the racial groups and the ages and the incomes and the education levels and the length of residence, all those things were pretty equal to 2011, so we can feel pretty confident about the sample. One thing that was different though is that compared to the phone surveys, we had more males take our survey, our mail-in survey, than females, which was something that kind of shocked the survey people. So what they had to do is they had to weigh everything. So all these results will be equivalent to the 2011 as we go forward. The first set of questions look at overall health. So, as far as what are their general views on how their life is in the community comparatively. In 2011, you can see that residents were overall satisfied with quality of life. They felt that things were getting better and that they felt they were in good to excellent health, the majority of those respondents. In 2013, you did see some changes. Residents overall thought the quality of life was lower, a little bit more pessimistic on that. They actually saw that the shift in quality of life over the past 2 years went from better to worse. When you look at, if it stayed the same, it was the same, and more people thought that it was worse than better in 2013. And the majority, again, felt that they were in good or excellent health. And, not surprisingly, age, income, education, ethnic diversity, all those things really impacted responses. You would have seen a lower response in those different age groups, or those different groups, excuse me. Looking at the seriousness of health issues, and again, this is one of the basic questions that when you do a community assessment, you just kind of gauge where are people's concerns at, what are they worried about. Again, in 2011, you can see, when you look at the very serious and somewhat or moderately serious categories, you can see that alcohol is definitely one of the things that people are concerned about. Same thing with obesity, people are very concerned about. The use of illegal drugs. You can see that the not sures really start rising. Smoking, people know it's bad for you. That is definitely, we've done a good job with that one. But when you look at the abuse and misuse of prescriptions, just pay attention to how, look how many not sures that we had. We have a lot of people that didn't necessarily know how big of a problem it was in 2011. We have done a lot of efforts to try to, raise awareness on the issues of medication abuse, but we haven't done enough. Quite frankly, we need to do more. And that's something that when you saw on your stat sheet, that's what our heroin and opiate stat's going to do. We're going to be really pushing it out there in 2014 to try to raise some awareness. Again, you can see, alcohol and misuse, you can see that there's some shifts in there between very serious compared to last time and moderately serious. Same thing with obesity. We've definitely raised, again, awareness on that issue. Use of illegal drugs. Look how much, this just goes to show the power of the pushback. It really has raised awareness on the issues related to illegal drugs. All the media attention that we've both put in and that we've actually benefited from has brought people's concerns up on that issue. But you can still see that there's some that are still not sure. We still have some that are not aware. Smoking, you didn't see really any changes there at all. And again, with the abuse and misuse of prescription medications, you see more people are concerned. They see it as a very serious or moderately serious issue. And you see that people, this not serious, that is the significant change in the data. But again, we still have too many that are not sure. Too many that are not sure. So, prevalence, we asked people if they take any medications. Half of the residents, so half of our 400 plus people take medications regularly. That is not necessarily any change from the last time, and we actually saw that, as far as the percentages goes, I'm just looking at the raw data here, not surprisingly, again, that, the older you are, the more medications that you're on. With our male survey, we had more people of that older age group that participated. So, we did see some skewing of the data there. Low income were more likely for, my notes are scattered. Low income were more likely to have medications for temporary conditions compared to chronic, and more men versus women were taking no medications at all. So when you look at, again, if we had more men in the data pool. Again, I'm not going to go through a ton of this because I do want to make sure you have a very good survey, but just goes to show that we do have a lot of medications on the street. No significant changes, again, for people that use medications without a prescription. My computer is not clicking. One thing to point out in this category, though, comparatively to the 2011 data, 18 to 24-year-olds are still the population that are the most likely to take medications without a prescription. So compared to those that are 65 and older, a quarter of those 18 to 24 said they've done so, and only 5% of those 65 and older have done so. So it just, again, goes to show we need to focus where we need to focus our energy. And again, as far as using medications for for alternative reasons, such as to get high, no significant changes there as well. Though we did see people that are 55 and older decreasing in that category. Use medications not as prescribed. 9 out of 10 say that they had not, compared to 8 out of 10 in 2011. So we have seen a decrease in those that said that they use medications not as prescribed. As well as there's significant change that you can see here in the second bullet. 90% said that they had not in the last year taken a medication that's not prescribed to them, and we actually had about half of those now. So we did see a decrease in that, which is very good as well. I'm sorry, that's 30-day data. Perception of availability, where people think they get their medications to get high. Again, this is a perception question. This is an actual question. Perceptions play a big part in things. We asked in 2 different levels, whether it was they thought they were getting them from family or friends or from medical providers. And you can see the data side by side. On the left, I didn't mark, I apologize. This is 2011 again and 2013. Where do people think that they're getting it from? Obviously, in 2013, more people believe that they're getting it from their family members or friends, or they're not sure if they're getting it from family members or friends. They're pretty sure up here. There's definitely a bigger scale, but here it seems like people are going one way or the other. And again, not sure if people are getting them from medical providers. At this point in time was when they first started discussing the issue, 2011. Issues still started coming up. Healthcare systems started looking at prescribing practices. It's an ongoing thing, but a lot of things have changed. But you can see the data is definitely, people are making much more, not sitting in the middle of the category. Sources of medications, the light blue is 2013, the dark blue is 2011. People do still believe that they're getting them from family members or friends. So when we look at who we're targeting, Peggy Curtis here in the back, I'm working with her with the Partnership for Healthy Aging. We want to make sure that seniors, for example, who have the most medications, a lot of them that are regularly abused, are securing their medications properly. And I don't see Police Chief Joning here today, but we'll go over the importance of securing and monitoring those shortly. So that slide kind of speaks for itself. The question here was, do people feel that prescriptions are readily available if people so choose to abuse them? You can see that people definitely more strongly agree that these medications are available, people want to use them, and just kind of check out here as far as if they disagree with that comment, there's definitely more of a percentage that disagree with that comment compared to now. People do feel that there's more on the streets, or they're just not sure. They don't have any idea what's out there anymore. Perception of harm, how concerned are people about medication abuse? Between the 2 years, again, you can see that there hasn't been a huge amount of change, but the difference is significant. the difference is significant enough that they earmarked it as something that we should pay attention to. These two are the ones that really speak to me when I look at all the data. And this is the one that I looked right away to. Looking at, and I apologize if these are kind of hard to read. I hope they're all right. Whether or not people think that prescription medications are safer than street drugs. And you can see before that, the strongly disagree. Again, awareness has been raised. That people strongly disagree compared to before, they really didn't know. So it's something to point out that definitely people are seeing that, that shift has changed as far as whether or not prescription medications are safer, and indeed they are not. And we asked whether or not they think it's safer or it's okay to take more than prescribed. You could see again that there was some changes and some shifts in the perceptions of people there. Our diversion efforts. Again, that's our disposal program. We asked people if they've had expired medications in their home. We actually found, same as last time, that our young adults are the most likely to have expired medications in their home if they do take them. So we did see some of the rates. Again, they've gone up as far as having expired medications in the home. And then, are they aware of the medication drop boxes? And again, we've actually we've seen an increase in this. We're actually pleasantly surprised that we had so many in 2011 because it was a new program. I remember that Rothschild was the municipality that most readily could recall the fact that they have a drop box there. But I can tell you that our medication program, if you're not for sure or you're not certain where they are, we've got 5 locations. There's little cards in the back with all of them. If you'd like a stack for wherever you work or play, or we have a bunch of these, just let me know and I can get you a good sized stack of them. But we've collected over 4 tons of medications in almost 4 years. We've collected over a ton a year. It's amazing to me that it hasn't slowed down, but they are definitely keeping busy with that. We ask people how they dispose of their medications. Do they take them to a medication drop box site? Do they put them in the trash? And you could see, we've reduced the number of people that are putting it in the trash, but we've also seen an increase in the people that don't use medications at all. So it's probably evening out just a little bit. I'm happy to say that less people are flushing them down the toilet. And we are seeing, well, it looks like again there's a little bit of a drop in respondents taking them to the site. Not too concerned about that again because we have less people taking them. The last question that we asked as part of that survey is collecting baseline. This is our baseline question. The other ones we could compare. We wanted to see how many people have heard of the Alcohol and Other Drug Partnership. We've gotten a lot of great media attention lately, as far as the work that we're doing, as well as we wanted to see if people have heard of our Pushback Against Drug Abuse Initiative. So of those respondents, almost half have heard of the AOD partnership. They recognized it. We had a picture of the logo, and we had the name, and they recognized it from that. So that's a branding recognition. And same thing with Pushback. We had over 1 in 5. So we thought that was pretty good results. Again, with Pushback being new, and this survey went out in August. So that was only just a few months of exposure. So we thought we were doing pretty well. So continual effort is needed. Like I said, as far as we're planning on pushing this out and making this one of our main goals here in 2014. You can see some of the bigger survey samples, and really what's recommended is that we need to continue our awareness efforts, but we need to also look at what's in the community. But in just 2 years, we are making a difference. People are seeing awareness because, if you've kind of followed prevention, as people become more aware, the perception of risk goes up, and we have seen those 2 correlations move together. So that is very good news. And again, in just 2 years, we've made a significant impact. On that, I'm going to turn it over to Lisa to go over Lisa Ebert from Aspirus. She can introduce herself with her title because I'm the screwed up. She works in the emergency department at Aspirus. Thank you, Lisa. Did you need anything? No, I don't need anything. Do you want out, or are you gonna?
Yeah.
Are you gonna stand up here next to me?
No.
Hello, I'm Lisa Ebert. I am the supervisor at the Spirus Emergency Department, and I'm going to talk about commonly abused medications. And I'm going to just briefly touch on it in several different areas. One of them is just kind of a list of what is commonly abused. Melissa has some sheets that, are they on the table? They're in the back. It says commonly abused prescription drugs. And this is a national list. So there's some categories on here I'll talk about, but then I'll talk about what we're actually seeing locally. And it can vary a lot just by community. And primarily it varies by availability. So if you have prescribers in the community that are willing to prescribe that, that's going to become your more commonly used or abused. So basically, as it lists on this sheet, it talks about categories of drugs. The first one is barbiturates. Probably the most common one that we'll see is phenobarb, and that's not real common in our community, or not what we see in the emergency department. Benzodiazepines, which common drugs would be Ativan, Valium, Xanax, Klonopin. Those we see fairly commonly. And in a little while I'm going to talk about what we see primarily for overdose patients as well. So remember that category. Sleep medications, Ambien is probably the most common that we see routinely in our emergency department. And none of these drugs are prescribed through the ER. So people are getting them from their primary physician or buying them. The other category that is listed then falls under opioids, which there is a lot listed under that. That would be any of your narcotics that can be readily available. Probably the most common, that OxyContin, Vicodin, Percocet, those are some of the more common ones that we see. Those are the main categories. Drugs that we see that people come looking for, and in our emergency department, as I said, we do not prescribe, other than narcotics, we do not prescribe any of these. So to some extent, that's a deterrent to patients or to people, because once they find out that they're not going to get it, word spreads quickly. It also spreads quickly based on what primary physician or what clinic readily gives these drugs. And people will tell you that, well, I know I can go to such and such a clinic and I can get this. And they share that information. Some of the things that, how do people get started? How do they get started with, abusing the prescription drugs? And one thing I want to, as I thought about this, as we ask people, how did you become involved? How did you first get your, say, narcotics? For a lot of them, it's teenagers that are injured in sports-related injuries. So they come to the ER, they come to a walk-in clinic, and they're given Vicodin, potentially, for a sprain or a strain or a break, or they have their wisdom teeth out and they get some Vicodin. So it's common things that a lot of our teenagers are having done that it seems very innocent at the time, that they get, a handful of medication to get them through, a minor surgical procedure or an injury. And that's where they get their first experiment with the drug. And they realize, hey, this gave me a good feeling. How do I get more? And you'll hear the conversations, and you hear the conversations among adults as well. They may have had a surgery and say, hey, I have some extra Vicodin. I'm going to save it just in case. And some people joke about it, but that's where they initially get started or get interested. And then it's looking at, where can I get more? Where do they get it? As I said, walk-ins or emergency departments for initial injuries, but also their primary physicians. A lot of people that we see that are abusing prescription drugs, they doctor shop. They'll list, well, I have all of these primary physicians, or I've been to all of these clinics, or there's a reason that they have, as they say, they've fired their physician because they weren't willing to treat my issues. That right there is a red flag. If you are hopping around from clinic to clinic or from system to system, they know that there is not a consistent sharing of records between different healthcare systems. So they feel that they're safe. If I go to one clinic in this community or this health system, nobody's going to know if I go to the next one. What they don't realize is that there is some sharing of information, and it's not hard to pick up the clues. Some of the things that we do see with abused medications is overdoses. And we don't collect data, looking back at our data, we don't collect data on what the overdose is. So our categorization for overdose is just overdose. So it could be intentional, unintentional, it could be street drugs, it could be prescription drugs, it could be over-the-counter drugs. So I couldn't get a lot of data to look at that initially. From working in the emergency department for about 16 years, Tylenol is one of the most commonly overdosed medications. So it's an over-the-counter medication. Couple theories on that is that I think people think Tylenol is not real dangerous, so this is sometimes a plea for help, and they have an overdose of Tylenol. Tylenol is very dangerous. It's very toxic to your liver. It's a very bad drug to overdose on. The other thing is mixing Tylenol with something like Tylenol PM is another common overdose medication, and Tylenol PM has Benadryl in it. So the combination of Tylenol and Benadryl can be very toxic and lethal to people. So that's a common one. Tylenol is easy to get, and it's something that most of us have in our medicine cabinet that we don't think of that that's a potential overdose medication. Usually it's teens and young adults that are going to use the Tylenol. Another one that we see commonly is Ambien. So a commonly used sleep medication that we see a lot of overdoses from. And then probably followed by Xanax and Klonopin. And I'm just speaking primarily from my experience in our emergency department on what we see. But as I said, we don't keep specific data on that and what they overdosed on. And that's all intentional overdoses. One other thing I wanted to touch on is we talked about prescription medications, but the medications that you can get in an emergency department, and what are people looking for? What do people have the drug-seeking behavior that they come to an emergency department for? And primarily, our two primary drugs that they're looking for is Dilaudid and morphine. So they're looking for your narcotics, and they come with pretty consistent symptoms. So anyone that presents to the emergency department with dental pain, headache or migraine, back pain with no injury, or maybe they had some injury. Usually they're going to say there's no injury, I just have a chronic back problem, or kidney stones. Those are our four most common diagnoses for people with drug-seeking behavior. And the reason is all of those diagnoses usually don't get tests related to them. So if you come and you say you have abdominal pain, we're going to order a CAT scan and you're going to get other tests that go along with it. They don't want tests, they want the narcotic. So a headache, if you make it sound bad enough, you might get a CAT scan of your head, but for the most part, these are people that will tell you, oh, it's a chronic headache, it's a migraine, but they will present with, this is a horrendous headache, but they will be eating chips and drinking their soda while they're waiting to be triaged, which any of you that have migraines will know that the last thing you want to do is eat. You want to keep your eyes covered from the light, you have your head down, and you physically look very ill, usually by the time you come to the emergency department. So that's one red flag. Dental pain, we see a lot of people with dental pain. Most of the time people think that's not something you would go to an emergency room. We have a whole dental room because of all the dental pain patients that we see. And again, you're not going to get a lot of tests related to a dental pain. They want their narcotic. If we put the narcotic on the same prescription as an antibiotic, they're going to consistently not fill the antibiotic. They don't want the antibiotic, they want the narcotic. If the physician offers them a nerve block for the tooth, it's not what they want the narcotic. And then they'll say, well, I don't have a regular dentist, there's no way I can get into a dentist, and so they'll come back repeatedly. And they may also share that they have also been to other emergency departments in other towns. The great part is the emergency department staff in general, we connect, and we have a lot of staff that we share with other emergency departments. So to some extent, it's a wonderful feeling when someone presents in triage and they said they've never had this before and they've never been treated, and here's a nurse triaging them that also works, say, in Anago, and just saw them yesterday for the very same symptom. So there are people that are very wise to shopping around, going to multiple walk-in clinics, multiple emergency departments. But eventually when you question them, they're going to slip up in some way. They'll say they haven't been treated, but then they'll, list Vicodin as one of their meds, or they'll list something that they've seen a physician in the past. Kidney stones, another very common one. If you've ever had a kidney stone, it's excruciating pain and you get narcotics right away. You also know that if you pee in a cup and poke your finger with a needle and put a drop of blood in there, we're not going to question that it's a kidney stone initially, and you'll get your narcotics. So that's a very common theme that we see. But somebody that has a kidney stone has some very distinct characteristics. They're very pale, they look sick, they are miserable, they're writhing in pain. Some of that stuff that you can't fake, and we catch on fairly quickly. As I said, back pain is a common one as well. So there's a lot of themes that we see with patients. There's also patients that, as I said, have shopped around from physician to physician, and within our medical record we have a way to highlight them, to make us aware, to share amongst physicians and medical staff that there is a potential problem, or maybe there's a pain contract with their primary physician that they will not receive narcotics at any other facility. Some of our physician groups are having their patients sign contracts, all patients. So one of our orthopedic organizations has everybody sign a contract when they start. So you break something, you go to them, and they will have you sign a contract that says, basically, you will not receive narcotics over the weekend, because when is the ideal time to say you need more narcotics for your broken ankle? It's on a Friday afternoon when the on-call doctor is on that doesn't know you. And so they have made a blanket statement to all patients that if you run out of medication, you need to call before Friday at this time and know over the phone. Prescriptions will be given on Saturday or Sunday. So it holds all people accountable that, if you need these things, you need to ask ahead of time. So those are just some of the things that we are trying to do to help with the commonly abused medications or the requests that we have.
Just for timing's sake, we're just going to kind of roll through our presenters, and then we will have time for question and answers at the end, because I want to make sure that we get everything covered. With that, Dan, Chief, with us today we have Chief Cook Joling from Fernand Water Police Department running out the door and coming down the hallway to talk about the importance of securing, monitoring, and disposing of any medication.
Thank you. I was so impressed when Melissa called me and I had the opportunity to talk to this group, and then I just talked with Chief Sparks, and apparently I'm like the freshman team.
I started with my board, Dan. Get on my board, and then I'll...
That's quite all right, Melissa. No, I'm not volunteering for anything else. No, I'm glad to be here. And really, she's asked me, and she's given me a time frame, so I've only got 5 or 6 pages of notes. I often tell myself when I sit and listen to Melissa and the group present, and Jill, is that I'm so glad I grew up in the time I grew up. Our biggest thing was, who was the doper and where would you get the beer? Life has so changed, and in fact, to kind of dovetail off of and I'm glad to hear that you do that, because we have this, I don't want to say, especially down in Cronenletter, this onslaught of mysterious crimes, but crimes that makes no sense. The guy that gets beaten up with no marks on his body, and the only thing they took was that pill bottle that was down inside the cargo pants. It doesn't make sense. Monitoring and drop sites, yes, we are one of the 5, I believe, here in Marathon County, and we have it set up for a 24/7 access. It's right under the U.S. flag on the front of our building. No semblance in any way, shape, or form was meant by that, but it's just so that the folks can get there, and that gets dropped right into the police department, so it's a secure site, as we would want it to be. The one thing that I've noticed and made a note, and I wanted to mention, was is you could share with folks is please take some. The interesting thing is I found out doing a little bit of research is that fentanyl, anyway, some manufacturers recommend that you flush it. Talking about flushing was that, you know, as Melissa's, her stats are starting to show less people flushing, and I thought, yeah, what are you going to do? Flush it, not a big thing. But now just Cronin-Wetter alone, the amount of stuff we take in, if a third of that is flushed, it's going to affect our water systems. So we would rather have it brought in, but what we are seeing are people dropping things such as mouthwash, toothpaste, basically very benign over-the-counter, which just adds to us having to deal with that. And so we would like to stress folks to please either read and see if in fact it is, call our experts and ask if in fact you do need to drop it and or dispose of it properly. Then by all means do so, but otherwise this takes, and liquids, if you could stress the folks to please bag it. Leave it in the container, put it in a good old Ziploc bag and put it in, that way if it hits, and there's a bit of a drop and we have it designed as such so that even Kareem Abdul would have a hard time getting their hands in the box, but it just makes for a real mess if the bottle doesn't hit where we intend it to hit. Drugs, we've already in Cronin-Wetter, to let you know, the small big village of Cronin-Wetter, we've already had a death. And what statistics I think are starting to show, and if this wasn't already mentioned, is that many times in the case of these young folks, they get started on what's readily accessible. And once that's either gone or these things are just totally expired or they can no longer get it, then they switch to the more creative stuff. And in Marathon County, I think as anybody that works within the justice system here will be able to attest to you that we are seeing not only cocaine, crystal meth, you name it. It's out there and it's readily available. Heroin, it's terrible and has terrible effects on folks. We end up seeing the worst of the worst. Not only that, we end up dealing with people that are under the effects of these drugs that are not controlled, and it becomes at times a life and death situation where we have to take really extreme actions, and that is not our intent. We wish everybody would, you know, yes, Mr. Officer, thank you very much, and I'll go sit here and behave, but that's not always the case. So all we can say is these sites are out there, 5 I believe throughout Marathon County. Please feel free to use them. Ours, and I don't know if Rothschild is, I believe Colby Abbey. We're 24/7, so 24/7 around, doesn't have to wait for these drug take-back campaigns. Anytime, we're there, and but we sure would appreciate the assistance. So I'm going to turn it back over to Melissa.
Thanks, Dan. And it's good that you, I do apologize, 1 for the small print and 2 for the gobbledygook on the back. I have no idea, and I was asked if you need to be on drugs to read this, and I'm like, so, you can actually download this yourself online, check it before you print it. One thing before I turn it over to Jill, I want to point out Michelle Armstrong with the Safe Kids Coalition. They've actually, one of their goals is to decrease the number of accidental ingestions, because we know that about almost 70% nationwide of accidental ingestions are in toddlers 5 and under. So they've actually done some tracking on what kind of things people accidentally ingest through the emergency rooms, through the emergency room at least Aspirus, and you know, it's an initiative that on all different levels. So we have from the beginning on with the Safe Kids Coalition to reduce accidental ingestions, all the way up through seniors through Partnership for Healthy Aging to help with the importance of securing and monitoring those medications. I always tell the story, it was my niece's 2-year-old birthday party, all family and friends. My sister is fragile, I guess. She had a knee surgery, I think, at that point. So she was on crutches, and of course, you know, they send you home with a 30-day supply of Vicodin. All I know is that, you know, again, all family and friends, we knew everybody. She had a shut medicine cabinet above her toilet. Somebody dug through her medicine cabinet, found the bottle that was in the middle of everything, took half the bottle. And she didn't realize it until then later when she tried to take something. So these are just family and friends. You never know. So no matter if they're your medications, if they're a parent, grandparent, encourage people to get them up and away, get them out of sight. If they're not using them, please use our disposal sites like Dan said. Rothschild is the other 24/7 site. With that, I'm going to turn over to Jill to talk about a very exciting new program in the state of Wisconsin, the Prescription Drug Monitoring Program.
Hello, my name is Jill Mashad, and I am the Director of Pharmacy at Aspirus Wausau Hospital and a pharmacist. And I'm going to talk about Wisconsin's Prescription Drug Monitoring Program. This is a program that the legislature enacted in 2007 and became operational just this year. What this program does is every time a prescription for a controlled substance is filled, the pharmacy has to report that information to a state database. So controlled substances, it includes the items Lisa was talking about with our narcotics, our opioids, the Vicodins, the OxyContins. It includes stimulants used to treat ADHD, so the Adderalls, the Ritalin, which also has abuse potential. Xanax, Ativan, all of those medications. So there's this huge database that is being created at the state, and pharmacies or physicians, if they're handing out these medications at their office, have to report within 7 days. So it's not quite real time, but it's pretty close. So within 7 days, this information is in a database. Once the information is in the database, any practitioner, so physician, physician assistant, nurse practitioner, pharmacist, can log into that database, get a secured username, and either look for a specific patient or a specific prescriber to see what kind of habits they have. So the data in there now is from January 1st. So the emergency department could start utilizing that as another source of, are they doctor shopping? Have they gone to several different physicians, several different pharmacies? And then pharmacists are looking from the other end. Are there prescribers that we don't want to fill their prescriptions because based on their history, it looks like their prescription prescribing is inappropriate? So patients can also check this database to see if their information is being reported appropriately and get that corrected and utilize it in that way as well. So Wisconsin is one of the last states to implement this, and right now 49 of the 50 states have a program in place. Missouri, for some reason, is the outlier, which seems a little odd, but Missouri doesn't have a program. Since these have been in place in other states for a number of years, there is some literature out there on how well this affects drug use, and it's kind of mixed depending on the program. There are some states that gather this data, but prescribers cannot access it, which kind of leaves the question, why are you collecting the data if nobody can use it on an individual basis? And the states that have the best success at reducing inappropriate medications are ones that actually send information out. So in our electronic world, or at least what I like to think is our electronic world, if a prescriber is trying to prescribe a Vicodin for a patient, they would get an alert saying, hey, did you know they've gotten 5 scripts in the last month? So Wisconsin is not there yet. New York State is the only state that has that proactive system right now. And their curve as far as prescription abuse is not going down yet, but it's not rising as quickly as other states. So we're hoping that is the future of how these programs can be used. On the back table, there is a brochure that, to me, most importantly, has the website information. And the website, to me, because I'm a pharmacy geek, is just fascinating. So they have data and statistics for since January 1st of this year. And in the last quarter, there were 2.5 million prescriptions for controlled substances in Wisconsin, 153 million doses. And to me, this is just like really cool stuff. That's like, wow, that is a lot. It also breaks it down by county. In Marathon County, for July through September, there were 23 doses dispensed for every person in the county when we average out the information. So this database is in its early states. It's collecting the information, and prescribers, pharmacists are just trying to figure out how to use it to make our patients safer. And there will be time for questions later. All right, who wants to talk next? A nurse's story.
Oh, thank you, Jill. Thought if I just sat there.
I hit enter.
Right. It's okay. Hopefully everybody got copies of this. There are ones for law enforcement. There's one for prescribers. And then we also have posters that I have a stash of. So if you work in a facility that you want any of this information, I can get it for you.
I like that I have the microphone. Usually I'm pretty quiet. Hello. I was very grateful to talk this morning and to be soon an advocate here on the council board. Those of you that don't know me, which are most of you, you might have sat next to me in a meeting. You might have sat next to me in church. You might have seen me in the marching band as a volunteer mom. And I might have been your nurse. And I am also a face and a voice of prescription drug recovery, and I'm glad to be on the recovery side for sure. And I just want to say too, I was always that kid in high school and college that if the speech class teacher said, hey, do you want to go first? I was always like, yes, so I can get out of the way. So I've been sweating it out in the corner there this morning. I'm glad it's my turn. So my prescription drug abuse started in my early 30s. Before that, I had alcohol in my teen years and in college, and that was pretty much it. How did it start? I had a family member who visited the ER frequently and her practitioner frequently because she had chronic pain, and her prescriber would prescribe her a lot of meds. So she had a pharmacy, or we had a pharmacy at home, Vicodin, morphine, a lot of it, up to $200 a month she would get. She didn't take all that, and she would say, oh, are you having cramps? Oh, here, you can have that. Oh, you bumped your leg, do you want a Vicodin? Okay, well, I said, why not? Even though I knew it wasn't my prescription, I was already a nurse by then, but the drug did make me feel good. And as an overachiever and a perfectionist for many years, and a busy mom of 3, and a nurse in a very high-stress job, I did inpatient. I'm an inpatient obstetrics nurse. I'm also a sexual assault nurse examiner. I said, yeah, I kind of like it. Well, those of you that don't know, addiction can spiral out of effect very quickly, and it did take over my life. So by my late 30s, the masquerade I thought was working, of taking the drugs and nobody knew, I could still be perfect. Yeah, people knew. And lucky for me, I had someone that confronted me, and I broke down and said, yes, please help me. And that person saved my life. So that was 8 years ago. And I'm very grateful to be here today. The other reason I decided to join the council was I think education is really important. So 7 years clean I had. There goes the overachiever and the perfectionist. I, didn't relapse. I was strong in my recovery. I thought it's never going to happen to me that I would relapse. My therapist told me, be careful. For years he said, the disease of addiction is cunning and it will wait until you're vulnerable. And it did. And I had a weak moment and I relapsed in August of last year, which led me to having my license suspended as a nurse, and I lost my job. Hasn't been pretty over the last 18 months. But I can say that I've been clean again for over a year, and I'm happy for that. And I'm also very humbled and have learned a lot more about the disease itself, that it is tricky, and I need to be on guard all the time. I need to have great support, and I need to be taking care of myself every day. I think it's important. Now, luckily, the state of Wisconsin is one of the states that has a monitoring program for their licensed professionals, so I have been able to keep my license. I was suspended for a period of time, but now they have reinstated it with very strict restrictions. I have at least 52 observed urine screens a year, as well as hair screening, which detects alcohol and any substance for up to 90 days. Those are all out-of-pocket costs. Cost me $60 a pop to pee in a cup, and it just cost me $320 to have a really kind of crappy haircut for my hair sampling. Not this one, but... And let's see, any medication that goes in my mouth, I must report to my monitor on a daily basis. If I have anything prescribed by my doctor, it has to be sent to my monitor. If I pick up a prescription, it has to be faxed to my monitor. And then if I'm at work, right now I have restrictions where I can't pass narcotics. So this is a 5-year program. If I do not comply, my license will be suspended or revoked. So that's my story. Questions?
I think we can probably open up to questions for anybody,
Yes.
any of our presenters.
Thank you. Did you have a question for her?
Comment for Christine. It takes such courage to come in front of a group and tell your story. Such a touching story, and it sounds like you became addicted to drugs quite easily, correct?
I did. I never thought I'd become addicted to drugs. I wanted to be the opposite of the person who I was getting drugs from. And I was a nurse and good in my field, and I never thought it would happen to me.
I think you're telling your story is such a contribution to the community to let people know that it can happen so easily and what a challenge it can be.
It can happen to anybody. It crosses all lines. Yes.
So thanks for your courage today and sharing that.
Thank you.
Any other questions for any of our presenters today? John, or comments?
I just wanted to ask Lisa Ebert, are you guys seeing an increase in your use of Narcan?
Yes, huge increase.
We see a huge increase in Narcan, as well as Narcan that's being obtained in the community and used prior to patients ever getting to us. So there's a lot of, especially heroin overdoses, that are using Narcan before they ever get to us.
Thank you.
Any other questions?
If you have another, do you have another comment?
I have a question for Jill.
Okay, then we'll bounce to Dan.
Okay. Why was Wisconsin one of the last ones to convert this?
Couple reasons. One is, we're Wisconsin, it's safe, nothing happens here. So it wasn't seen as a serious issue that resources needed to be put into, where states like California, New York, or Kentucky were more on the front edge of, yes, we recognize prescription drug abuse as an issue in our state and want to do something to try and control it. Like I said, Wisconsin, nothing ever happens here. We're safe, everything is good and happy. So that was one of the reasons. And then it does take resources and commitment on the state to gather the data, set up the databases, and get involved in that way.
Okay, on the board.
And my question was for Jill as well. That last little tidbit of information that you said was the 23
doses per person in Marathon County.
And when you say doses?
Doses. So that would be like one Vicodin tablet.
Okay.
For example. And I did just want to add, on the federal level, they are looking at making Vicodin a Schedule II controlled substance, which would mean Vicodin could not have refills like it has now, and it would need a signature prescription from the physician. So they're looking at that to decrease the availability of Vicodin. If you go on the website, you can see the most common medications that were prescribed in Wisconsin, and Vicodin tops the list. 21% of the scripts were for the hydrocodone, acetaminophen. The next drugs down were in the 6%. So that potential change in the federal schedule of the medication could help us here in Wisconsin as well.
So we do have some folks here from the medical examiner's office. I was wondering if you had some information about how drugs are affecting your day-to-day.
So far to year-to-date, I'm just at the medical examiner's office. I'm the newly appointed medical examiner, so I'm the new John Larson. All right. To date, right now we have.
Well, that's just for the recording.
Okay.
So you don't have to worry. Just speak loudly. You don't even have to hold it. You can just
To date, we have 15 drug-related deaths for the year. I had to do some statistics for school. 45% of all of our accidental deaths are attributed to drug and/or acute alcohol intoxication. 35% of our motor vehicle fatals can be contributed to acute alcohol intoxication and/or drugs. And 25% of all of our fault-related injuries are attributed to acute alcohol intoxication. To date, we have 11 confirmed overdoses. 3 are polypharmaceutical, meaning more of the prescription drugs and a combination of other type of medications. 2 heroin deaths, 2 methamphetamines, 1 cocaine, 1 morphine, 1 fentanyl, and 1 huffing. We also have additional 4 related deaths, which were not overdoses. 2 of them were heroin, and 2 of them were methamphetamines for the year. And that's all.
Any other questions?
I can just say that, in my tenure in office as the medical examiner, these numbers are significantly increased over anything I had ever seen. And I think that's something we need to be aware of.
Well, last year alone, we had 6 overdoses. 4 of them were heroin, and 2 of them were polypharmaceutical. So our numbers are getting a little out of control.
Now, Ron.
I was just wondering, currently, what is the rule or the law about picking up a prescription? I mean, can I go pick up a script for my friend? Can he give me written statement that says Ron can pick up my prescription? Is there any, how's that work?
Yes, you can pick up a prescription for anyone depending on the pharmacy. If they do not know you or your friend, they might ask for ID. It's not required other than if they are not familiar with you. So if you were picking up for a friend, they may ask for an ID, but it is not required. There is a proposal in the state legislature to ask for a picture ID for picking up any controlled substance. So we'll see if that makes a difference. I'm not sure with this other program already in place if it would make a lot of difference. We're already tracking a name that way.
Well, the only problem is they track a name, but I can go in and say I'm Melissa Goddard and I can get a subscription. I've had that happen. Not I've had that all the time. There's no rule. If I know anyone in this room gets their medication dropped off at the Walgreens, and I know it was just sent in, I can go there before you get there and say, I'm here to pick up a prescription for Vicodin for Ron Alexander, and I can get it. I've had that case, and I've had a lot of those cases. So that bill, which is being...
That's Senator Representative Nygren's package.
Yeah, that seems like something that we ought to
very simple,
get behind, right?
I mean, very simple, common sense way to deal with it.
Did you have anything else to add from the DA perspective?
The numbers are out of control because I have them all. And they're no fun. They're a lot of work.
And people are hurt.
Yeah, heroin overdose deaths, the problems they cause for the community, prescription overdose deaths. Marathon County's really in the grips of an epidemic, and not only is it clearly affecting the person who's no longer with us and their family, but it's a strain on the community, it's a strain on law enforcement, so it's very important that we continue the good work that we're doing.
One thing that we hinted to, and then we kind of hinted to, as far as you had to start somewhere, as far as gateway, when you use the term gateway drugs, which I know in discussions with like Rob Menser with the Wausau Daily Herald, he hates that term. But, again, it comes down to access. You got to start somewhere. And, when you look at the issues of addiction, especially when we look at our young people, we do need to make sure that we're considering mental health. I see a lot of our mental health partners here today, so thank you. Thank you for coming. Because when we look at it, 1 out of 4 people that are diagnosed with a mental illness end up developing a substance abuse disorder. Half of those with a substance abuse disorder develop a diagnosable mental illness. And that's some national data. But when we look at half of the people that are diagnosed, with a mental illness, are diagnosed before the age of 14. 2/3 by the time they reach the age of 23. Or 3/4 by the age they're 23, excuse me. So it really does play a part. So if access to medications in the home is the thing that we need to make sure that we're addressing as smoking rates go down, as less people are filling their homes with alcohol. I don't know if that's going to happen in Wisconsin. However, it's something that we need to pay attention to. So is there any other questions or comments? No? Jean, would you like to wrap things up, or would you like me to wrap things up? All right, so our next meeting is not scheduled till February. We do not have a topic yet, so if you do have a burning desire to learn about a certain type of topic of any sort related to substance abuse, any drugs that you want to learn about, any treatments, any prevention, or what have you, let us know. We're always looking for ideas. Watch for our annual partner survey. It's going to be coming out also in February. That helps us make sure our meetings are effective, we're meeting your needs, as well as mark your calendars for the celebration. It's going to be fantastic. It's always a great night, always a lot of fun. And if you're interested in any of those trainings, talk to myself or Erin. We can get you set up through the registration if you're unregistered today. Beyond that, I have nothing. Take some supplies to go. Have a wonderful rest of your day, 30 seconds ahead of time. And thank you to all of our new board members.